Hi, I'm Joe Walker.
I'm Brittney Ellers.
And today we're talking all things related to flat feet, everted ankles, and foot pain.
Ouch.
So first, let's talk about the different types of flat feet. There are a couple different types. Rigid versus flexible. What's the difference? Rigid is often caused by genetic issues or structural abnormalities, deformities, things like that. These are often arches that are hard to change due to the structural part of it and the rigidity versus flexible.
Right, which you can totally move out of. It's like a functional thing where you can make changes if you just focus on the right muscles and focus on the right movement. You don't have to have these types of flat feet forever.
Yeah, these types of feet, we often call it excessive pronation. It's usually when the foot collapses on weight bearing. So without weight bearing, the arch is actually maintained. And the second someone bears weight on that limb, the arch starts to collapse down. These are the types of arches that we can fix with alignment, restoring balance to the foot, ankle, knee, and hip. So we're gonna talk about different problems that arise as a result of flat feet or excessive pronation. Brittney, what do you got?
Well, you know, something you've taught me, Joe, really is just this kinetic chain that happens. So when you start at the feet, and you really live a lot of your life on your feet, right? That's
right.
How you take in the earth, that's how you move forward, walking, running. So if we're thinking about flat feet, if that happens, what automatically goes, ankles go in, then your knees actually start to turn in, which causes what we call a knee valgus. And then that automatically almost puts your pelvis into this anterior pelvic tilt, causing a lot of low back pain and just issues all up the kinetic chain. So we don't want that for you. And luckily, there's something you can do about it.
Yeah, this can cause a ton of postural issues. It can also cause imbalances at the hip. So if one arch collapses, that can cause unlevel or uneven hips, and that can cause low back pain. It can cause problems all the way up. Your feet are your foundation, so it all starts from the ground.
What about walking changes, gait changes? You know, if you are having flat feet, you have the flat foot, then what happens, Joe?
Oftentimes, if the ankle's limited in mobility, we tend to collapse at the arch. That causes that knee to dive in, creating strain on the inside of the knee, and then it causes unlevel hips, causes hip dysfunction, low back pain, all the way up the chain.
Just, you kind of look like a really weird model, just like, causes bunions too if you're in the wrong shoes.
So what are some signs of flat feet? Obviously, dumping inward of the arches. Oftentimes we see very little space here. That's called navicular drop or pronation. When that happens, it causes bunions to form. So when the arch collapses, we see that the big toe goes outward, and this is where we see the creation of bunions. And then also we see that these muscles that support the arch become overstretched and weak. So we have your anterior tibialis muscle attaches to the midfoot here, and the posterior tibialis muscle runs down around the backside there, and it attaches to the inside of the arch. Both of those muscles become weak, overstretched, lengthened. We want to try to work on contracting those muscles to support the arch and lift the arch up so that that dumping doesn't happen towards the floor. We also mentioned that when that dumping occurs, we get excessive strain on the inside of the knee here. So a lot of times people get medial knee pain, they get overstretching of this MCL muscle. Patellar tendonitis issues are really common. So it all starts down here.
I'd almost even say like lateral knee pain sometimes with that just rubbing and erosion of that cartilage. I'm like, what's the word? Yeah. Basically the space between your femur, your leg bone, your thigh bone, and your shin bone.
Yep, and IT band issues are really common. So with runners, when we're walking, if our arch is collapsing down and that knee's collapsing inward, this IT band and this whole TFL gets really tight and shortened, and that creates a ton of friction at the femoral condyle here.
That's happened to me when I was training for a half marathon.
Did it really? Yeah.
Yeah, when I was a PT aide.
My last name is Walker, that's why I don't run. So, on top of all this other dysfunction, we have so many other issues that occur. So not just dysfunction at the foot, but everything all the way up. So let's talk orthotics.
Have you seen my orthotic?
It's a big topic of discussion. Orthotics are often prescribed to patients with excessive pronation or flat feet. Orthotics are oftentimes almost like a crutch. So I always tell my patients, imagine if you put a back brace on and you wore that all day, every day. When you take that brace off, your core is gonna be weak, you're gonna be unstable, you might even fall over because you're relying on that external support for stability. Now down at the foot, if we put an orthotic in our shoe, it's doing the same thing. It's just holding up your arch. When you take it out, that arch collapses down, we get flat feet.
It's the same thing when you have an arch that's built into your shoe. I mean, I'm guilty, I wear my Birkenstocks all the time, but they do have this nice little built-in arch. However, am I able to walk around at home barefoot? Am I able to walk around on uneven ground without pain? Yes, because I've trained my foot.
Yeah. So speaking of training, Brittney, what can we do to train our foot?
Oh, there's so many little things. And we're gonna show you a little sneak peek into the new foot program with MoveU. So let's go over a few of those.
Let's start up with toes up, ankle inversion. So Brittney's gonna take her toes up off the ground along with her foot. Yep, just like that. And we're gonna work on inverting that foot. Now what this does, it activates both that anterior tibialis and the posterior tibialis muscle to create inversion of the foot, which helps to support that arch.
So going from neutral to inversion. Basically like you're trying to show or look at the underside of your foot.
Once you master that, now you can go foot down on the ground, and this is more closed chain inversion or inversion of the ankle here. So what we want to do is try to lift the arch up by keeping the foot down, and this basically inverts the foot, creating more of an arch.
I like to think of this like I'm creating a home for a bug to live underneath my foot.
There you go.
I don't want to squash the bug. I want it to live.
Next, we can also add a band, right? So place a band just above the knees. What we're gonna try to do is restore that entire kinetic chain. So remember, we talked about when the arches dump, it causes knee collapse inward. So if we think about restoring our arch, so trying to lift the arch up, bending the knees a little bit, pushing out against that band, we get the entire kinetic chain aligned and centrated for ideal joint mechanics.
I feel like I've seen, even when people do like just the cue of pushing into the band, sometimes their feet don't go with it, but I think generally because everything is so connected, you will feel just a little bit of that lift. Maybe even building from the ground up, foot first and then knee drive.
Yeah, absolutely.
Yeah. And you can maintain that, hold that. Maybe you take a few squats, standing all the way up, keeping it as you come down. If you really want to get fancy, what would you add next?
Yeah, then we could add even side steps. We can add lunges to the mix, keeping that alignment maintained, pushing out against a band.
Step.
Yep. Single leg balance ultimately. But it all starts with the foot. So in our programs, we start with ankle inversion, eversion. We start with ankle circles. We start with a nice foundation down below and progress all the way up the chain into our back and core programs, integrating everything together. Do you have anything else to add?
I was just gonna say, these are kind of cool.
Yeah, toe
If
spreads.
you really want to get acquainted with your toes, toe spreaders are so nice to just open up the playing field a bit. And then you can start to do them by yourself, spreading the toes, bringing the toes in. We call this toga. I like to call them ogre feet.
Great
Don't
job.
make fun of my ogre feet, YouTube.
Most people actually struggle with this, and that's because we cram our feet into narrow shoes. So a lot of times people lose toe function, they lose the ability to control their toes. Your toes should act like fingers, right? So they should move independently. She does a great job being able to spread the toes and move them around, but a lot of people struggle with this.
It's like, I like to actually hold hands with my feet like this. If you don't have, or you don't want toe spreaders, that's fine. But can you do this and just stick your fingers in between each and every toe? Give yourself a little stretch and a massage. That can be a nice place to start too.
Let's talk about symptoms that arise from flat feet,
Let's do it.
right? So a lot of you are experiencing a condition known as plantar fasciitis. Now this is a direct result of flat feet or collapsing arches. And the reason this occurs is because when the foot collapses down, it overstretches the tissue on the bottom of the foot, known as the plantar fascia. This causes repetitive strain and inflammation on the plantar fascia, leading to pain. So what we want to do is try to create an arch to put that tissue on slack. So on top of that, when the foot collapses inward, go ahead and turn around, Brittney. We see when the foot collapses inward, look at the line of pull on the Achilles tendon. That is not normal. So when there's an angle line of pull, this creates repetitive strain and inflammation on the Achilles, and this can cause Achilles tendonitis and even ruptures of the Achilles as well. We can also have issues such as posterior tibialis tendonitis or tendinosis because this muscle on the back side here gets overstretched and strained, as that arch collapses inward. And then we move up to the knees. We talked about the MCL can get sprained, it can get strained here. We can get collapse of this medial joint line and excessive shear force on these menisci on the outside. So that's the cartilage that lines the joint here. You can get compression there. You can get IT band syndrome as a result of shortening of all this tissue on the side of the leg. Moving up the chain to the hips, we see an anterior pelvic tilt. This causes excessive compression on the low back. It can cause crowding in your hip joint, leading to hip impingement syndrome. All sorts of things can arise, right, Brittney?
Absolutely. I feel like you're naming so many things that people can resonate with. Can you resonate with this? Let us know in the comments.
All as a result of your feet. Remember, it's the foundation. So if you have a flat foot, especially a flexible flat foot that can be corrected with alignment and balance, you can fix all these issues that occur throughout the body as a result of the foot collapsing.
I think if you really want to facilitate change for a lifetime, you're gonna have to put in the work, especially if you've been living with these flat feet for a long time.
And just a side note, a lot of medical interventions these days are temporary fixes. We talked about orthotics. You have cortisone injections, we have surgeries, we have various interventions that attempt to resolve the issue. But at the end of the day, if you're not fixing your alignment and fixing balance within your body, those issues are gonna return. So these are temporary fixes, and we want to reassure you that exercises and strengthening and creating balance will help to resolve these symptoms.
Resolve your symptoms, fix your flat feet.
Guys, we have a comprehensive program, MoveU.com.
Yeah.
Our new flat foot program, we highly recommend it. It'll help fix and take care of all these things that we just discussed.
Go ahead, check it out now, right now.